A pregnancy test detects the presence of the HCG hormone in urine or in blood. This hormone is produced by the female body when fertilized. The most popular way to test for pregnancy is to use a home pregnancy test kit. In most women, HCG is released 6 days after conception, and the levels of HCG increase with every passing day of pregnancy. On average, these levels double after every 2 days. A home pregnancy test can detect HCG approximately 1 week after you miss your period. When to take a test to ensure pregnancy test accuracy. The 97 to 99% tests claims in home test kits are true once you are further along in your pregnancy. For this reason, it is appropriate to wait at least 1 week after you miss your period to take a pregnancy test. The bottom line is that you should wait for as long as you can before testing for pregnancy at home. So, are you pregnant? Let's see how to take the salt pregnancy test. Salt is crystalline and hence is a pure chemical. It can detect HCG in your urine and test whether you are pregnant or not. For best results, please use your early morning urine. For testing, we use a pregnant woman urine and a regular urine. Add several spoons of salt in both urines. Wait at least 3 minutes before making any conclusions.